Having an advanced care plan and current goals of care support timely and effective communication with residents and families and sound decision making, ensuring the resident has a comfortable, dignified death. Okay, I've got all the social information about you, Hilda. I'd just like to understand what's been happening medically with you.
Well, Mum's been in and out of hospital this year with a number of things. She was well and living on her own, but she had a fall and fractured her hip a year ago. They'd found that she'd had a small stroke. Since then, she's had admissions with a couple of heart attacks, a chest infection, and her diabetes and blood pressure has been all over the place. She gets really bad angina and insists on taking a lot of anginine, and that makes her fall. She's been living with me because she couldn't manage her shower or meals, but with full-time work and 3 teenagers, it was difficult, wasn't it, Mum? Oh, this admission, she got a UTI. She was delirious. It just seems that she gets worse with every admission. It makes you wonder.
Sounds like a hard year. Can I ask, has your mum ever done an advanced care plan? And has she appointed a medical power of attorney?
Oh, they're always asking that. Mum doesn't want to talk about it. I make all her decisions now, don't I, Mum?
It helps us to know what your mum's preferences are if she becomes unwell again.
She's a tough lady. She'll want to see her grandkids grow up.
Oh yes, that's something we'd all like. Have you ever had discussions with Hilda's doctors about how they think she's going?
Oh, they say she's old and things are wearing out, but aren't we all?
I'm going to give you some information and a form that will help you understand how best we can support what you'd prefer if you get unwell, Hilda. Let's meet again when Hilda has settled in. Hilda's settled in well, I think. As long as we make sure to leave some biscuits for when the grandkids come.
Yes, she seems quite happy. I read the document you gave me. I know Mum pretty well. She is practical and understands you can't live forever, but she'd like to have treatments if they'd help. She doesn't want to give up. My brother's older than me, and if I go by the document you gave me, he will be the first decision maker. He will want Mum to have everything done for her.
Please don't think this is about us not doing things for your mum. We want to do what is best for your mum. I've looked at Hilda's discharge summary and chatted to her GP. Hilda's health has deteriorated significantly over the year. However, she has recovered well after her hospitalisations, and apart from the most recent admission, her hospitalisations haven't been too traumatic. If she became unwell and we couldn't manage her care here, we would send her to hospital for increased care. Her GP has documented this.
Yes, the GP rang me and he agreed with the hospital doctors. She was slowly wearing out. He said if she died suddenly, she wouldn't be able to be revived because she has so many things wrong with her. I had to convince my brother that would be the best for Mum.
The doctors are right. She is slowly wearing out, so we are going to keep a close eye on her and keep you up to date. Look, if you're worried or concerned about anything, please come and speak to us. I'm glad Hilda is back with us from her most recent admission to hospital. It sounds like her stay in hospital was a bit traumatic.
It was terrible. I had to stay with her all the time. They couldn't get her to settle. It was so noisy and no one had time to sit with her.
Oh, she has been so sick. She has had another heart attack and got pneumonia and also become delirious, I understand.
The doctors told me she was going to die.
Pretty hard words to hear. I guess they also told you this could happen again?
Not really. They said she wasn't for resuscitation and she wouldn't need to come back to hospital.
Your mum is so unwell. The doctors don't think she would benefit from being admitted to hospital for aggressive treatment. They can come here and give her gentle treatment if we think we can reverse things, but always keeping her comfort in mind. Her dementia has progressed, so it is important we ensure she is comfortable.
I know. She doesn't even recognise the grandkids now. I don't know if my brother will agree. He thinks the doctors just don't want to treat her.
I thought I'd discuss Hilda. She's been a resident for 6 months. She's been recently discharged from hospital following her third myocardial infarct, complicated with pneumonia and delirium on the background of several strokes and heart failure. Her goals of care are for non-burdensome treatment here and admission to hospital only if her symptoms can't be managed. Her daughter understands this, but her son, who is the eldest, thinks she should have active management in hospital. Also, there is no medical power of attorney.
Is it possible for us to have a case conference with her son and daughter to help him understand that their mother is deteriorating and that her heart failure and dementia aren't reversible? Look, we can treat infections as long as the treatment isn't burdensome, but the most important thing is Hilda's comfort. We should liaise with her GP and arrange anticipatory medications in case she deteriorates rapidly and enters the terminal phase. Has she got any symptoms at present?
She gets chest pain frequently. The angine isn't effective anymore. She's also breathless and becomes very anxious, especially when we're showering her.
Can we arrange medications to manage these symptoms as soon as possible?
So these are the medical problems your mother has. Her specialists don't think that the treatment will benefit your mother.
Well, I do. We want everything done for Mum.
We know how much you love your mum, and we want to do everything to ensure your mum is comfortable and not frightened. We can't cure her heart problems, and the angine is no longer effective at stopping your mum's chest pain, and that is frightening her. I'll start some medication to treat the pain, and it'll also help with the breathlessness. It's a very safe medication.
You're just giving up on her. She'll just die.
Roger, your mum is deteriorating because of her illnesses. Not treating her symptoms will mean she'll suffer and be increasingly anxious. These are the things that cause people to deteriorate even more quickly. If we thought she'd benefit from intravenous antibiotics, we could get the hospital team to come here and give them to her. But yes, eventually your mum will die from heart failure and dementia. The important thing for her and the family is that we keep her feeling safe and comfortable. Sending her to hospital would achieve nothing but increase her anxiety and her distress.
Well, at least she gets oxygen and a drip there.
We've tried to give her oxygen here, but she keeps taking it off. It won't benefit her as she'll get distressed if we strap the oxygen on.
He's right, John. Every time she goes to the hospital, the oxygen and the drips really upset her and she comes out worse.
She's drinking enough at present, but she'll gradually eat and drink less over the coming weeks. This is nature's way of ensuring a comfortable death. She'll become sleepier, not because of the medication, but because her body is getting more frail. She may stop being able to swallow, then we replace her medication with injections under the skin.
She will probably spend more and more time in bed. We'll make sure she's well looked after. We'll also keep her mouth moist and clean and make sure she is comfortable.
Thank you. Mum was so comfortable in the last few weeks. I think she even recognised her grandchildren again once she'd stopped worrying about the pain.
We really miss her, but at least she was peaceful. Your nurses did a great job.
This graph shows the pathway of deterioration as the older person with a life-limiting illness ages and becomes more frail. The timeline depicts when advanced care planning and goals of care discussions with the resident and family should occur, and interventions and support from hospital and community clinicals as the resident deteriorates towards death and dies.